Hello, my chat with Dr. viewers on Afrojamsnetworks. Una welcome for another interesting topic. Today, we're going to talk about some issue where it be very, very common inside society. When we start get this conversation, we're not going to realize how important this particular topic is. But before we want to get into the conversation, make her introduce with resident scholar for the house, Dr. Fidelis Do. Dr. Do, welcome back.
Thank you. I'm glad for coming again for Afrojams Network.
All right. So today we get some very interesting topic. For Oyibo country, they call and say insomnia. For this woman country, where they call and say insomnia. But for una the local for back the way this plenty Oyibo talk or this plenty woman language, una no really understand. Now it means say people then where they get problem for sleep. And as I don't introduce the topic for people then where they get problem for sleep, I don't see a couple of una dan she down back, una wake up, una dan shake. Say, I talk insomnia, and I know we understand why I talk. Now I see people they get problem for sleep. I don't see people they be rattled. They don't wake up now and say, oh, what did they talk about sleep? Na me. Yeah, now you. So we got time to find out exactly. I bring Dr. Do today for studio. Make we talk about this problem for sleep. Where they call and say insomnia. Dr. Do, welcome back. What to be insomnia?
Well, as you don't already explain in for white man way, insomnia for we normal pidgin language just means say you get problem for sleep. Say you go for bed, you not fit sleep, or you go try for sleep not come. So
Okay.
na problem for sleep.
So no problem for sleep.
Problem for sleep.
But problem for sleep will be plenty different kind, right?
Yes.
So give with a different kind variation, then different kind type for problem for sleep. Will we classify them as insomnia?
Yes. So that problem for sleep day kind. Okay. White man they say primary insomnia. Where it means say you dey go for bed, you go turn for bed, you don't walk the whole day, you tire, you go take say you go for bed, you just lay down, you go rest, you sleep peacefully, you go there, you not fit sleep. You turn, you go this side, you dey check about this thing, check about this thing, check about that one. You not fit fall asleep. That one na they call say na primary insomnia. Okay, they not get the cause, they check what did happen, they not fit no. Okay, the second one, na the one where you dey go for bed, you sleep fine, you fall asleep after you don't walk the whole day, you fall asleep, then something happen, you wake up, then you know if you go back to sleep. Or you sleep fine, then you wake up early, more earlier than what way you would think. So you sleep. So now the different kinds of sleep problem that we'll get.
Okay. So as soon as I hear Dr. Rodan say people then way they go for bed, they turn, they spin, okay, you try, you turn pillow, you turn this other pillow, sleep no catch you. You wake up, you go do anything if you do sleep no still catch you. Now one. Then the other one are people there they sleep, they wake up. You don't sleep, you no last for the sleep, you wake up. How about some certain people that they sleep as you've even dropped in for 2 miles away. Check up, they don't wake up.
Very light sleepers.
They call them light sleepers.
Yes, yeah, that is, they sleep, but they not get into that deep sleep where you sleep, so you wake up for morning, you know, say your body don't rest. So the least noise, as you talk, pin drop, they don't already wake up. Or small noise from outside happen, they don't already wake up. So that one to another problem where if fix them.
Okay. So a big problem for America, right?
A big problem.
Sleep. So we feel quantify generally for something that they call the prevalence. It means how that thing be present inside a community. What do you feel? What do be statistics for insomnia, generally speaking?
This topic where you bring a very important topic because most people they not understand the importance of sleep. So we day for work during the day, night we get to sleep. You know, but for America here, you know, people they work for night, work for different shifts, and all those things. But in general, all over the world, statistics don't show say 1 out of 3 people they go during their lifetime go get serious problem for sleep. That means say 33%.
1 out of
Three people.
Three people.
Let me say you're cameraman for day, you and me. One of we will get serious
No,
problem
there's
for
six,
sleep.
so it means that two of out of we six.
Oh, now we see. Oh, I don't see the other people there. So 2 out of 6 people there for year, they will get problem for sleep sometime along their
So
way
now
for
which
their life.
kind of the three sleep the way insomnia way be talking. Now which of the three they affect you?
Oh, now you want to diagnose me?
No, I just ask now because
all them affect me.
all they affect you.
depending on the day of the week and the week of the month.
How about the month of the year too?
I don't know that one, but they affect me and all the time, depending on what they do. Yes.
Okay, that's interesting. You said 33% of the people that generally for world.
Yes,
they get some type. They get some at least some sort of they suffer from some sleep
problem.
Correct.
Yes.
Okay. So 1 out of 3 people then.
Now serious problem.
Interesting.
A serious problem where we not take them the way we're supposed to take them because now issue where if you get a lot of different ramifications, different consequences.
Before we come for that one,
Yes.
make I ask you some question about. So when we talk about say insomnia, some cut off the way you feel say you know what. At this number, if you say you suffer from insomnia, hours.
If you mean like hours for sleep, it really depends on the age of the person.
Okay.
You know, small picking they sleep much longer than adults. As we grow older, the amount of sleep we need sometimes to be less. Okay. So for baby them and the one the way they still crawl, they feel need like 10 to 12 hours of sleep a night, okay, or in a 24-hour period, okay. So they go sleep them fine as long as picking wet, you don't feed it fine, you put it for crib for bed, you go sleepy peacefully, okay. Toddlers them, so 10 to 12 hours for them. Now, as you become a teenager, you're there for secondary school, you're there for high school as a teenager and all that, 8 to 10 hours be okay for you. Okay, when they finish sleep, when they sleep for that length of time, they feel refreshed the next morning. As an adult, when you don't finish high school now, you be big man. Normally, they say anything from 7 to 9 hours with an average of 8 hours. So 8 hours sleep, now really what we need for we body for rejuvenate, for work fine the next day.
Okay, so it says 7 to 8 hours or 7 to 9 hours a day.
Yes.
How about if the weekly average? Today, make we say today I sleep 6 hours. Tomorrow I sleep 12 hours to compensate for that one. Then the next day I sleep 4 hours. Then the other day, now the average, now daily or now weekly? Weekly day okay too?
Weekly, it really depends the kind of work where the person they work, but it's fine for do this average now daily average.
Why?
Because if you sleep today 4 hours, okay, you check so if you perform well the next day, that one is not going to happen. Okay, if it happen or it not going to happen. So, but when you sleep today 4 hours, it means say you did lack 4 hours of sleep since we say average now 8. Okay, it means say you get a deficit of 4 hours. If tomorrow you sleep 6 hours instead of the 8, you don't get now a deficit of 2 of tomorrow plus the 1 of today. That's 6 hours now deficit. If the same thing happened the third day, you add another deficit there, another 4 hours, now 10 hours that already. If you check, say, at the end of the week, you feel make up for all those hours, it means, say Saturday, for example, it means you get to sleep that 8 hours plus the other 10 hours where you don't be deficit. You feel sleep 18 hours a day or 20 hours a day if you get a deficit
now
of 12.
Now, me I bring you for ask you a question. You want to ask me a question.
No,
now
give one a general question.
Interview
give one a general question.
Okay. I just say you want to ask
no,
me a
for
question.
audience, I ask you.
No,
you
because
sleep 18 hours a day.
No, I say then Dr. Dowan. No, I not get me sleep problem because the now you want to accuse me for you.
Now, what's you leave for America?
No, I
leave for America, you don't get sleep.
No,
problem.
I just talk now.
Okay,
no bring personality here now, doctor.
Okay.
Maybe we just. So the other question I would ask you now, I say because we talk this. Prevalence and 33%,
yes.
Right? Mm-hmm. I want to ask you whether because you don't talk say age, and we understand that one small people can sleep longer because of kind of physiological requirements and demand. Mm-hmm. How about any geography that plays some part for this? Places a bit too cold, people they sleep longer. Places a bit too hot, people they sleep shorter, or any geographical differences there for this issue for insomnia?
I will use the example now for place where we there now. You see say now 5 o'clock one reach, place on dark. Okay, where for winter time, 5, 6, you need to put light for house, place on dark. When summertime, sometimes it be, me I be tennis player. So I go play my tennis. Sometimes it be 8 o'clock, 8:30. We still there for tennis court for outside with the play.
Indeed.
Because light still there.
Indeed.
Okay. Something there for brain, where they call it melatonin. When the hormone where they control sleep. Okay.
Indeed. So repeat the name for the hormone again.
Melatonin.
Melatonin.
Yeah, melatonin.
Okay.
So now, when light day, okay, that melatonin not be secreted enough for put you to sleep. So we get areas of the world, since you asked now about geographical areas, make I answer that one. You go for Greenland, for example, Iceland, all those places, them, where the people, they see sun are like 3 months out of a year.
Indeed.
The rest of the time, na darkness. So those extreme
Alaska,
cases, Alaska, yes, for Conaway. So we get good luck say for tropics. We get almost equal day and night. So we brain not the confused that kind of way. So for answer your question directly, those people they get sleeping problems for their own way.
Okay.
Because their nights be longer, maybe they sleep longer, and then their days be shorter, they work shorter. So, but in general, the whole world gets sleeping problems, as we talk, 1 out of 3 people.
Interesting.
Yes.
So before we get deeper into the conversation, I just want to remind one of follow we on all the social media platforms, Facebook, Instagram, TikTok, YouTube, X. I know that yes, X. When I just follow, when I share, when I like, we put any comments and questions, then we will get back to when we'll be interested, very interested for when questions on this particular topic. If the questions will not be answered, the next time we'll go bring Dr. Doe or someone else may if we answer those questions for now. So when I continue for follow we. So before we want invite people then for start following for social media platforms, you be talk something here for the beginning, right?
Yes.
Say sleep is split generally or insomnia. Sleep problem into 2, primary and secondary.
Yes.
Make we talk about briefly, you don't describe the primary, say you no get cause.
Yes.
You just sleep, you get difficulty for sleep. They don't come for say, Dr. Dove, wait till me, you don't do all kind of tests, you don't do all kind of analysis. You just say, NS, yeah, problem, this or primary.
That's not true sleep problem. We don't know what to cause this problem.
Okay. We go come ask you, like, holistic care person, how for treat me. But make we go for the secondary.
Yes.
One. Give we some causes for secondary insomnia. What to be secondary insomnia, by the way?
Secondary insomnia, now the one way, for that one, for the first one, we don't say we not know what it cause the problem. For this second one, we know we don't talk with you, we don't sit down, we talk, we analyze everything. We know say that something don't cause this problem where you get for sleep. Okay, and some of those problems, them, as you say, make I give you some examples.
No, before we want go, because say you get it like say the way you lick your lips, it like say this conversation don't sweet you, it don't ginger you.
No,
fine,
na important in way where we get to tackle them well.
Okay.
Because na problem way
No, we will take short break.
Yes.
When we take this short break, few seconds.
Yes.
So that make you recycle all the causes and for secondary insomnia.
Okay.
When we come back, you line them, you give them bam.
Yes.
One time.
Absolutely.
Then we'll take the short break.
Okay.
We'll come back. All right, my people, then when I welcome back, I just want to make we take 5 seconds, drink water, because this particular side for the conversation, this secondary insomnia, now the more important one, now the bigger part of the insomnia, the sleep problem.
Correct.
And the reason why now the bigger part, not only because the prevalence, but because there's some things they do if you deal with them. Secondary means something to cause them. So we go ask Dr. Doe, may at least the things and when they cause secondary insomnia, it go start from the top to the bottom, then we'll come back asking how to fix those issues. Dr. Doe?
Yes.
Talk to me about this secondary insomnia.
Well, secondary insomnia, like you talk now, in the way we figure the cause, we know say that this thing they make you get this sleep problem. Okay, sometimes na stress na the biggest one. Okay, so this stress will be, na stress from work. If you been a stress about your person where is sick, if you been a stress about financial issues, but stress na the one way na a big problem where you go for bed so you live.
Married na part of it. How you doing me so?
Marriage?
Marriage
will be a good thing, or
No, because you talk stress, you talk about work, this, you don't talk that one.
Well, if your marriage not the worker, of course, it could bring about stress. Okay,
so part of it.
If you did think of divorce and all those type of things, it will make you be stressed. Okay, so if you be part of it, okay, so yeah, so those kind of stressful conditions, them, if you make you not sleep, so we at least we identify when we talk with you, we know okay. This man not if he pay his mortgage last month, and then this month don't come, he worry. So he now worry, he stress about this problem where he get to tackle him, enough he do him. So enough he fall asleep. Okay. Then the other one now work. Okay. Some people they way because of their work, it requires me they work for several hours. I go tell you one small short story.
Go ahead.
When I be resident, after you finish medical school, you go residency and all that. Hospital not get limit at the time where might be there. I don't know for una own time and for the time now. Okay, you did work so 36 hours. You did for work and all those type of things. So you did get sleeping problems when you do all those kind of long hours then for work. Okay, you go house, you go either oversleep or you not go feel sleep because you don't be used to not feel being able to sleep because of your kind of work.
Okay.
The
so time where will be there when I be enter, they will get this 24-hour limit.
Okay.
After you don't be on call 24 hours, you'll be forced for go house. Yes.
So when that time be better, no wonder you are still young. You fresh like this.
Yeah, the smile. Okay. I take that from you.
Okay. Mm-hmm. Then other things they do when medical problems. Okay. So people they way if you get back pain, for example. Okay, you go lay down for your bed. How if you manage sleep where you day in pain? Okay. So those are things the way they feel cause sleeping problems too.
Okay.
Then even your bedroom where you do want sleep there, your mattress. Okay, if you get that kind of mattress where you don't get them for 25 years, you never change them. All that cotton inside don't go one side, then the metal, so it chuk you, you could turn for spring. Now spring mattress, they call it, okay, spring mattress. That's spring them, yes. Mm-hmm. So it chuk you not go fit for sleep well. Then another thing, them feel being a mental health problem, you get anxiety disorder, you feel worried 1 day, 2 days because of certain things like we talk about financial and this and that. But if that worriness continue for a long time, that anxiety about certain things continue, they say you get anxiety disorder. So those kind of mental health problems, they feel cause you get problem for sleep.
Okay.
Other medical issues they as well, cardiovascular thing, heart problem, hypertension, diabetes, and all other kind of medical problems. They also make you get problems for sleep.
Before we go for some other topic, right?
Yes.
I want to ask you, because sometimes the way it like now this double-edged sword, right? Mm-hmm. Sometimes the way people they use activity for get tired, for go sleep.
Yes.
But activity if it cause you insomnia relative to the time for sleep. How about person where he go run marathon or you do some heavy exercise closer to bedtime?
Now,
talk to me about that one.
Closer to bedtime, light activity will make you sleep fine.
Okay.
But vigorous activity, meaning say that marathon where you talk like that.
Correct.
So if it make you tired, okay, you go so you sleep, but guess what? You go wake up, you not go feel sleep fine. So that one will cause that insomnia what we talk about.
Okay.
That secondary insomnia, that problem. So the advice now say close to your bedtime, no do vigorous activity. If you do just light meditation, light activity, small exercises and all that, we go make your skin just cooler. Then you sleep fine the whole night.
Good. Mm-hmm. Because my people, when you exercise, some certain hormones, they beat your skin to release them. Endorphins, adrenaline, and other things, where they excite you. Closer to your bedtime, if you just do that thing, after a while they tend to dissipate, right? They tend to be released from out of your circulation. But if you just do the exercise, they'd still be inside your skin immediately after the exercise.
Yes.
To the point where they will be now, all the inside excite you.
Inside excite you, your sympathetic tone will be elevated.
Indeed. So your adrenergic tone will inside be elevated to the point where you will feel sleepless. That insomnia will kick in, right? So people, then whether they do exercise, you want to do heavy exercise, so you be macho man, closer to your bedtime. Then you doubt why you don't feel sleep.
Correct.
Now the reason that why you don't feel sleep.
One of the reasons in that.
How about some medicine that they way or some substances that they way they feel causes insomnia problem? We'll talk about that elephant in the room.
We get like truck drivers them, and even just we would drive for road where you don't drive. Sometimes you retire. You say, hey, maybe you stop. You take coffee, okay. So if you be regular,
when you want to go to coffee store, so take care or be careful, because some people they inside this room, if coffee no day, so
they're not going to stay awake.
Continue.
Okay, so so people the day where they drink coffee all day long because of the work where they need and all that. So that one another thing will cause you that sleeping problem when night don't come. Okay, because you drink the coffee right close to when you get to go to bed. So it be advisable, say. The real average for coffee is a good thing because it helps for different things for your body. So average, now say if you drink 1 to 3 cups of coffee a day, okay, but no drink your last cup of coffee close to when you go for bed because it will keep you awake.
Okay, great.
Okay, and then other things then are street drugs.
Okay, I will ask you that one day.
Oh, you want to ask me? Okay, yeah, street drugs. Street drugs.
What do you mean street drugs?
Street drugs are illegal drugs the way. Where government not allow them, where medical.
You not get no medical use.
You not get medical use, and I think where the government frown on it. Arrest people.
PCP, na example.
PCP go make you stay. You will hallucinate. You will check say you fit carry this whole house worker.
Indeed. So if you be awake for like 3 days,
continuous.
Yes.
Okay. You fit jump on top motor. You fit do all kind of things. So those kind of street drugs, them they fit continue for. They fit keep you awake. Alcohol, na another substance.
Okay.
Alcohol and another substance where some people they check say they not fit sleep fine when they never booze. Okay. I go tell you say when they don't drink plenty, so you go sleep or you go fall asleep or you go for bed, you don't tire, but you go wake the sleep where you get now like up sleep. Okay. You go wake up early, you will get that second or that sleep or talk so where you fall asleep, the definition. You wake up, you know if you go back to sleep. So nothing that way alcohol will do for you. You go feel sleep early. You go for bed, you fall, you sleep, but now light sleep. The least noise we want to make sure you don't wake up.
Something that way me and you know, so they call it white milk, propofol.
Yes.
So it almost like that. It send you inside sleep.
It send you inside sleep.
Inside seconds.
Yes.
But as the thing just finish up, bam.
Now all that the effect of that substance just finish with your body.
You'd wake up like
you know if you go back
like
to sleep.
Springboard.
Correct.
So now alcohol
but the alcohol inside that group.
Okay, good. So now we don't talk about the secondary things and the secondary things or secondary causes.
Yes.
Or things that cause secondary
sleep
insomnia.
Problem. Yes.
Right? We go talk how to deal with them. Because it's be important for talk how to deal with them. But before we want to talk how to deal with them, we need to just talk insomnia out of the box. Something get some consequences. This insomnia they lead to issues. Right?
It lead to a lot of medical problems.
When we talk about some of the issues, some of the causes, some of the consequences of insomnia, before we can talk about how to deal with them.
Correct. So sleep, as we don't talk, be very important. So if you get sleep problem, you get issues the way they arise. Because of this fact that they sleep enough. Okay. Sleep now got the way say when you now during that sleep period where if it be for night or if it be for daytime for people they work night shift and all those type of things, where your body they cleanse itself, your brain, everything they rejuvenate, they come back in order, they prepare you for the next day. So if you not sleep, you get mental problems. We don't talk about anxiety disorder. We don't talk about depression. Some people, they will get obese, they go fat. okay, because of the fact that they not sleep enough.
So,
some people will be depressed because they not sleep enough. Yes.
So, Doctor, I want to make you repeat this one because nothing will feel happen both ways.
Yes.
So, stress, right?
Yes.
If it causes you, sleep.
Correct.
Okay. People and stress now kind of related some version for stress now kind of an underlying mental issue.
Correct.
But that one too, if it still cause you an issue for sleep,
Correct.
like you done mentioned.
Yes.
Okay. So now the problem where we did and I say now which one come first? This my sleep issue now as a result of mental issue or now this mental issue to cause me my sleep issue.
Now the problem that now I think that way it be difficult for discern for diagnose because if you get that primary one way insomnia where you know the feel sleep and it continue chronically. Okay, now another thing that we will get to touch acute sleep and chronic sleep problem. So acute sleep problem and chronic sleep problem. So acute sleep problem, if it be like jet lag, okay, you come out here, you go Cameroon, 6 hours difference and all those type of things.
So maybe define acute, what to be acute and chronic, generally speaking?
No, acute, generally speaking, means saying that it just happened for a short period of time, okay? And then it go away because you, for example, the jet lag we'll talk about, you move. Chronic one, that one way, if you sleep at least 3 times a week and for more than 3 months.
Great.
Okay, so now problem where it did 3 months and even
for
longer for a long time.
Okay.
So we talk about which one comes first. Okay, so if you get the stress for mental health problems where don't get you sleeping problems, okay, if it cause that insomnia, then now if you be person where you get problems at all, you start get insomnia for one reason or the other, not the acute, it become chronic, then that chronic now feed lead to so now a vicious cycle.
Indeed.
Yes.
Mm-hmm. So you can talk about sleep and then obesity.
Yes.
Tell me about that one.
See, when you not sleep fine, you remember we talk about how your body they rejuvenate, your body they come back, clean itself fine, things they rearrange itself, hormonal, physiological, all those things. Then when you sleep, okay, like time that your body recover for all those things. Then they get some be more technical. Some 2 hormones a day. One they call lectin, another one they call ghrelin. Okay, lectin na hormone way detail we say you don't chop flop.
Correct.
Okay. You don't chop flop, you don't need to chop anymore, you be satisfied. Then ghrelin, at one way they tell you, say, hungry, they do you.
Correct.
Okay, so you be hungry, continue for chop. Guess what? If you not sleep fine, okay, the next day or even the fact that you lack sleep, that hormone ghrelin, it be secreted a lot, okay? Then the lectin not be secreted. So you lack the lectin, the hormone way they tell you, say, you don't flop. That hormone be very little. The other one can come. Now it make you see some people then for night, they go wake up, because they lack sleep, they up for night, okay? That hormone don't come, they go for fridge, they open fridge, they take this, they take those things. So the physiological changes then for your body, it make you chop plenty and then you fat.
So the reason I ask is to me explain that fat.
Yes.
Because some person, they feel misunderstand this thing. So where I no sleep and insomnia directly they cause obesity. I want to ask you, may explain, you just jump inside the explanation.
Yes.
And which is so, make go again quietly and slowly,
Yes.
not quietly, slower.
Yes.
Explain to viewers the correlation, the relationship between insomnia and putting weight.
Yeah, okay. Besides the physiologic one where I talk about the hormones and all this stuff.
No, primarily just repeat that one again because it's be important for people to understand.
Yes.
You know, yes. Say, the fact say I no sleep, now you make me a fat.
Okay, yeah, that's right. No, because when you no sleep, okay, this human body be very complex. Okay, when you no sleep, the different physiological and hormonal endocrine kind changes that happen for your body. And that explanation, again, so now one of the changes that that way they happen for your body. So the hormonal changes, the way they happen, they make you be like you get to chop. And it make way, if you lack sleep, you get more appetite for go chop those things due to those hormonal changes. So that one a very important thing for consider.
Great.
So rest be very important.
So my people don't want those of you want to follow for social media platforms want to share. This is a very important information where Dr. Do they share with we. Before we take some short break and the last break, I just want me to go back again because we talk about some of the dire outcomes from outcome. Some they feel be dire, some they not feel be dire from these insomnia issues.
Yes.
We don't talk about an issue with weight. We don't talk about mental health, anxiety issue. Any other issues that they again?
Yes.
We want to share with viewers.
Yes. Issues the day with the day, they feel been short-term issues, acute issues, them due to the lack of sleep of 1 or 2 days or things like that. So, for example, as I begin to talk about my residency, and not be just me, even work, nurses and all those people, then when you go work long hours, you work 2-3 jobs, jump from this one, you lack sleep, sleep, okay? You come out for morning time, say, okay, you get to go house. You enter motor, you get what they call micro sleep. Because you lack sleep, you get deficit for sleep. So as you drive that motor, so your eye the cover 1 minute, 1 second, 2 seconds, this and that. And all you need, you go stop for red light safe sometime, the feet stop, you take off, or you even run the red light. You pass where stop. Because your mind not be, the concentration. As the way you don't lose concentration. So those are very important, and a very important thing is for the whole world. Okay, so sleep be very important. So now one consequence that of not sleeping. So especially if you go for some roadway now, you get line for middle, you drift. All you need now 2 seconds. You just go now. The other person they tip at the cam from the other side, 18-wheel at the cam. Then you there for your small motor. You just drift. All you need now just 1 second, 2 seconds. You drift on the other side. Then you don't need to worry for problem for sleep. Now you just sleep forever.
Something they call it irritability. People what be irritability?
Irritability means say they calm, they think correctly. You vex. This person calm. My brother can't say, no worry me. You just vex.
So insomnia get any connection with irritability?
Of course, you get a lot of connection with irritability because you never rest fine. Your brain it active. You not get rest, so you just become irritable. You vex with every person.
So I know some couple of people that way each time I see them, they just vex. I go check for see how much sleep they get, whether not that the cause they just vex each time I see them.
Yes,
we go find out.
We'll find out.
We go investigate.
And you feel they say, I don't know why this my brother they treat me so. Where sometimes some shift worker where he work some long hours, you did the vex with you. You don't know say lack of sleep is the problem.
Okay.
Now they will talk about when person come for consult, you get to ask about all these questions them holistically.
We go forget
the cause.
One so big one the way I want to make you tell with this with people them.
Yes.
Especially the younger people them, right? When they talk about sexual performance and sleep.
Oh, my
just take 1 minute. You say me too. Now we don't correct talk now. You say me too. Explain for this. It's a serious thing.
It's a serious problem. Right. A serious problem.
Me and you don't say it's a serious problem because it would face a lot.
Yes. So when you lack sleep, 1 day, 2 days, it not be too bad down at the acute problem. Now when you continuously lack sleep, what we say now chronic insomnia, chronic sleep problem. That those physiological changes again, those hormonal changes for your body, it happen. Okay, so we don't talk about the one how you get fat because you lack that sleep and all that. Testosterone, now hormone where your body is secrete for man picking. For female, you get estrogen, progesterone, luteinizing hormone, FS, all those things. So hormonal changes. Remember, if your body not be stable because of lack of sleep, all those changes they occur. So they don't show say if you for 1 week, if you get 4 hours of sleep, 6 hours, you don't get enough sleep, your testosterone level did drop by 18 to 20%. So now when it drop this week like that, next week it drop, then small time, your male hormone when it may give you strength, okay, you don't get that energy again. You just lack. First of all, you don't get any anxiety. You don't get interest, for hold your woman, for
No,
hold the same.
my people don't know.
When you not get interest for hold your woman to not get interest for hold you. So now both ways. So go ahead.
No, I when I know who me or doctor don't give that explanation. Because I see some eye and Connie eye they look me say no, not me I talk now. I give that explanation.
Yes.
Which is true though.
No, it's true.
Which is true.
Those hormonal changes them, the testosterone and all that, then it will lead, you see, Pago don't go walk, he don't walk so enough he sleep and all those things, then he get that problem we don't talk, testosterone don't go down, then he come house, or mommy, vice versa, mommy come house, you want touchy, he say, leave me, I don't tire. Now true tire, and because of all those things, then you go there, mommy go just say, hey, I said, this Monday, so he get something outside where he can, then I think make no one touch me. But when I lack of sleep, you see what is sleep problem, and that problem if you continue, so you want to see they then are court for divorce. Okay. Say because of all starting for sleep. So sleep now very important thing.
We're glad to you come today. Because it is the way that you look me inside studio. They like say we get people that suffer from insomnia around here. So we go take one quick break.
Okay.
My people will take one quick break. When we come back, as we've done tell Dr. Dona hematologist, oncologist, but now also holistic care physician. It means they deal with people their issues not only with medication. It will tell you how they treat this insomnia holistically.
Correct.
It will be the last part for the conversation, especially how we treat this last topic we'll talk.
What should be that?
Will they come back? More take 2 minutes.
Okay.
All right, my people, when I welcome back, I've said 2 minutes. No, it's not been at 2 minutes, it's been at 20 seconds. So we'll just rush to take my mob kene, if you don't understand what kene mean. I've just my mob slide.
Mm-hmm.
Now 20 seconds. So now we're going to talk about how to treat insomnia.
Correct.
I just want to talk briefly about the medical, because now a challenging thing, the medical, not controversial, but it be full of difficult ramifications to the medical treatment. So I want to just talk about that briefly before we go into the non-medical.
Okay. So medical treatment, as you know, may not be big on prescribing medication. So we will go for the non-medical, we'll probably dwell on that. So medical treatment get in place. Medical treatment meaning say you go prescribe medication for the person. It get in place, okay? Like we talk about that jet lag and melatonin secretion and all those type of things. So when you come off a place where dark day, you go for a place where light day, and then you not feel sleep, but when people they sleep for day, you get that 6 hours. It be okay for prescribe a small dose of the hormone where your brain for secrete that melatonin, where it make you sleep, you fall asleep. So you come out here, you go Cameroon, you go Ghana, you go Ivory Coast or any place where light still there, but not dark for here. Okay, so you prescribe a small dose of melatonin, make a jump start the sleep process. Then you go sleep well. They get over-the-counter medications them too. Little things them. They call them not big heavy things like tranquilizers, but just sedatives. Where you give them, it could just make the person calm down small things like antihistamine, Benadryl, stuff like that. If you take them for a short term, okay, they don't want to make you take those things then for long term because it will affect your brain.
So you come for the question I want to ask, right?
Yes.
That is because initially, which is true, though, you talk about acute and the chronic one.
Correct.
So you want to deal with the acute one with medication.
Correct.
And the chronic one, you go tell you how to deal. So you don't talk about the antihistamine and maybe the melatonin. At what point you go consider these sedatives then?
Yeah. So the sedatives, if we consider or the acute time, but the problem being I say these things they become addictive. They become addicted to it because you need them all the time. So it be very advisable for give those medications just for a few days. Okay. 1 week when you're jet lag or whatever be the cause your sleeping problems, when an acute problem, not be that chronic one will deal with. Okay. So you give them for that period of time till the person in your body adjusts again, he starts sleep fine. You stop those medications.
Any of them, the way you need to worry about the level of dependence?
Well, the melatonin, if as long as you stay on the small dose, I see for over the counter, they get 1 milligram, 2 milligram, 10 milligrams, 5 milligrams. Those are heavy doses. You don't need that kind of dose. Okay. So me, I prescribe 0.5. I say even take the 1 milligram, you break them into 2. Okay. You prescribe that one because once you don't jumpstart your brain for secrete the normal melatonin, and then you go back to sleep.
Nice.
Yes. Mm-hmm.
So maybe we're going for the elephant in the room, which is the chronic one.
Yes.
So if you put your any kind of benzodiazepines and for short acting, very short period of time based on certain circumstances, right?
Yes.
Okay.
Yeah.
Maybe we're going for the chronic one. How you treat the person where it come, and I go raise my hand right here. Mm-hmm. People the way they get
chronic insomnia.
Chronic
problem.
Serious one.
Yes. So as we talk, many things the way they feel cause the problems. That anxiety problem, Phoebe. Some person they want go for bedroom, so it be like for war they go. They don't be. They say, hey, that is they get that worry. They worry. They get that anxiety. Where this last night I not sleep. 2 nights ago I not sleep. I did go for this bed, so I go feel sleep again. So they get something that they call sleep hygiene. Okay, so you prepare your environment fine for sleep. Okay, so something they call cognitive behavioral therapy. Cognitive. So once they make you recognize the thing, they make you know the things them. So now talk therapy, where you sit down with either your doctor, a sleep specialist, or a mental health specialist, a psychologist, when they go over things them, they want to make you recognize the thing them or get to know cognitive. You get to know the things them way they feel the pain and the problems where they make you for sleep, so that you know say, okay. So now because I did do this thing or now so now you make an offer, so you recognize those things them. Say now so it did, and then you change your behavior. Okay, now the part that for the behavior you don't be able for no saying this thing, they don't talk to you, then you change your behavior. Now you say, okay. So now they tell you what to do.
Okay, because this one we worked really for like stressful situations. But my stress comes from the fact, say, tomorrow I go for pay my rents. I don't even know how I go pay my rents. They go for kick me out.
Yes.
You have CBT. You want CBT me. You want to provide me cognitive behavioral therapy. You counsel me all you want. Tell me how to recognize how to pay my bill. I don't get the money.
Okay. No, good one. Yeah, CBT 50 work, okay? Mm-hmm. Because when we tell you, say, that is not the end of the world, okay? When we don't recognize it, we don't notice the problem that where you get, and now they put you to sleep.
Yes, anytime we don't come towards the 25th of the month, I need to sleep.
You know the sleep fine.
Because I know say I get just 5 more days for
pay your mortgage or your rent, Yeah, so, but now we don't know the problem, okay? We will talk with you or how to, that's not the end of the world. No person can't cut your neck. The highest thing where they go do now say, when you never pay for a couple of months or whatever, then they can't kick you out. They go, now we look for way for help. Okay, organizations, they and all those things would look of different behavior, what we do for help you for that particular problem.
So now the part of one you talk about, because it is not only you say you do the behavioral therapy, the holistic thing, you also consider the person issues. It challenges
Absolutely.
them. And then you kind of refer them to resources the way community way for help.
Correct.
Interesting, good.
Yes.
How about besides the CBT, any other approach and the sleep hygiene and any other thing?
Yes. Okay. We talk about things the way they feel cause you get problems for sleep. Mm-hmm. So we want to say when you want to go for bed, when you don't know say you do work, you time that you can't reach for, no drink coffee. Okay. So that and all those and then apart them for the hygiene. Stop the alcohol. Too much alcohol where you could drink, you could put you then you could just dinner for light sleep. You'd wake up any small thing want make you don't wake up. Okay, so and then if now shift work where you do, okay, that one be a little bit difficult because you get to make money.
Yeah.
Okay.
Yeah.
But if you do work for night, you come back for house for daytime. No say for daytime, we don't talk about melatonin, how it be secreted, and for night you jumpstart sleep. So when you come back for house, you want sleep, make sure say your windows they be dark. You make the place dark, okay? Curtains the day down, lights are off and all that, because that one now na your own night. Now still part of sleep hygiene that. So you could fall asleep because you work for night. Now if you be person where you work now during the day, for night time, another thing for sleep hygiene, stay away from tablet. You hold a tablet, you hold for your hand. So
No, I know how I'm empty.
okay, all right.
My hand is empty. How you look, are they empty? You see my, you see
I
what
just
my-
the talk now because for that one, it means as we finish here, if you go for bed, keep that
No, my hand is empty,
keep
Dr.
that tablet aside. Keep that phone.
Oh, you tell people
aside.
the way they do for house, they keep tablet. Not for me, no.
So no, not for you. Not
Okay.
for you. You not get tablet now. Okay?
Exactly.
Right. So yeah, phone. Keep phone aside. Okay, because that blue light where they come for phone, it make your brain the thing say na daytime. And that melatonin, so now one problem that way they make people
repeat that thing again.
They scroll.
When you
for
talk
phone.
about this light and all of the
Yes.
the screen and
Yes.
all of that,
Yeah.
like just repeat why we keep some of these gadgets. Not only the noise will come out of them,
Yes.
but the light source.
The light source, that particular light where they come out of, they don't really make something they call and now say dark screen or something like that. Did it work for some people? They know they work for some people then. But when you there for that phone, you scroll. Oh, may I just look this thing for TikTok? Or may I respond to this message before I sleep? You did it, you scroll before you want to realize now 2 a.m. Okay, you know if you sleep. Or the light where they come from there, it stimulate your brain. Okay, your brain, the things in a daytime, and you know the secret that melatonin will get to put you to sleep. So that's a very important thing that for keep those gadgets them away. Turn TV off. I don't know why I even put TV for my room. I know they even look and say, when I don't enter my room, I want that sleep because I don't work during the day.
And it's not you say it's for insomnia.
No, but I don't learn now. I don't learn.
Okay.
So I turn TV off. I put my phone
Also,
by
you
the side.
CBT yourself, right?
That's correct.
Okay, that's nice.
Yes.
Any other ways, techniques that they way other than cutting those behavioral things, coffee, alcohol, prevent or stop vigorous exercise toward your bedtime, turning, make your environment quiet and maybe a little dark. Any other recommendations? And then if you make people then get a much better solution to this insomnia?
Yeah.
Other than, because if we know what the secondary, if we easily deal with the
correct
the cause. Yeah.
We easily deal with the cause when we know what to be the secondary symptoms. So if we prevent all those things all the secondary causes by advising people not to do the things and way they cause that
biggest problem are the primary.
Primary, yes.
Yeah. All right. Yeah. So my people we don't come to the end of this presentation today on insomnia. I hope say when I enjoy the conversation. When I continue for share, send when I comments, questions when I get them. If not, if we answer them, if Dr. Dono if we answer them today, we'll be back next time again with another episode of Chat with Doctor. Good night.